Hi, good evening.
Okay.
I'm Washing. My name is Marie Tai. I'm a student nurse practitioner. I will be doing evaluation today. What's your name?
Jason,
And how old are you?
22,
Okay, and you know what you're here for?
physical.
Okay, and any complaints?
No.
Okay, I'm going to ask you a couple of silly questions to assess your mental status.
Okay.
How did you get here today?
I drove.
Okay, and any problems getting here?
No.
Alright, so based on my initial general survey, patient appears to be healthy, well-groomed, medium built, sexually developed, posture is erect, patient's speech is clear, and patient's communicating with me, and level of conscious is intact. Next, I'm going to inspect your face. Patient has a symmetrical face, eyebrows are even, and hair distributed also is even. Looking at the hairline, I don't see any rashes or redness seen, and hair is distributed evenly. Next, I'm going to check your cranial nerve 7 with your facial expressions. Go ahead and smile for me, and frown, puff out your cheeks, raise your eyebrows. Okay, patient's cranial nerve 7 is intact. Next, I'm going to check your scalp, checking for lesions or masses. Might as well checking your infestations. No infestations noted. Patient's hair is thick and black. Alright, and next I'm going to inspect your cranial nerve 5. We'll have you close your eyes and tell me where you feel this cotton ball, okay?
Left cheek,
Okay,
chin,
alright.
right cheek.
Okay, patient's cranial nerve 5 to sensory function is intact. Same cranial nerve 5, we're going to assess your motor function. Going to have you open and close your mouth. Move your jaw side to side and forward and inward. Okay, patient's cranial nerve 5 to motor function is intact. And next I'm going to check your brows and close your eyes for me. Alright, and no, your lids are intact, no swelling, the eyelids are within margins. Go ahead and open your eyes. Bulbar is clear. Palpebral conjunctiva is clear and pink. And puncti, no discharge or exudates noted. Next, I'm going to check your cranial nerves 3, 4, and 6. Just follow with my pen light, okay? Okay, cranial nerves 3, 4, and 6 are intact, no lid lag. Next, I'm going to check your accommodations. Go ahead and look at that picture at a distance. Okay, and look at this pen. Patient's cranial nerves 2, 3, and 4 accommodation of pupils is intact by dilation seen on the pupils. Next, I'm going to check your pupils with this light, cranial nerves 2, 2, and 3. Okay. Okay, cranial nerves 2 and 3 are intact. Patient's pupils responded to direct light and consensual. Okay, next I'm going to inspect your ears. Ears are symmetrical. They are left positioned at the level of epicanthal folds. I see no lesions, no redness noted, and no discharge noted on the outer ears. I'm going to check your cranial nerve 8. Go ahead and plug your ears on one side and tell me what I whispered.
1 and 2.
And go ahead and plug all the other ears.
5 and 6.
Okay, patient's cranial nerve is intact. Next, I'm going to check your nose. Your nose is symmetrical, no deviation noted. And go ahead and plug your nose and breathe on the other side. Okay, patient's nose are patent, no distress noted there. And next I'm going to inspect the inside of your nose. Okay, checking for any lesions. Mucosal is pink, septal is straight and intact. Next I'm going to inspect your mouth. Just go ahead and your lips first, and checking for any cracks or lesions. And patient's lips are pink and moist. And go ahead and open your mouth. Mucosa is pink and moist. Lift up your tongue. Stenson's and Wharton's duct is intact. Soft and hard uvula palate is pink. And I'm going to check with the tongue depressor. Okay, and go ahead and say ah for me. Okay, cranial nerves 9 is intact. Tonsils is visible. No redness noted. Go ahead and stick out your tongue. And go ahead and push with this tongue depressor. The other side. Alright, cranial nerves 12 is intact. And go ahead and open your mouth one more time. I see the teeth are all present, no decay noted, and tongues are moist and no lesions noted as well. Next, I'm going to check your neck with your range of motion. Go ahead and look down, up, side to side. Okay, patient has a full range of motion. And next I'm going to check your nose. Alright, let me know if there's any tenderness noted. Okay, preauricular, post-auricular, tonsillar, submandibular, submental, occipital, superficial, and go ahead and shrug your shoulder. See better, no tenderness or swelling noted. Okay, next I'm going to check your cranial nerve 7 by putting my hands on your shoulder. Go ahead and shrug your shoulder. Alright, patient's cranial nerve 11 is intact. Next, I'm going to inspect your thorax. Patient's thorax is symmetrical with conical shape. Patient's breathing is normal. No distress noted. No intercostal. Patient's non-labored. Next, I'm going to palpate your lungs. The symmetrical. Go ahead and deep breath. Okay, patient's lungs are symmetrical. And let me percuss your lung fields. Okay. The apices of the lungs. The scapular. Okay. and the right lobe. Go ahead and lift up your, okay? And I percuss resonant. Next, I'm going to listen to your lungs on the same fields. And take a deep breath when I put the stethoscope on your lungs, okay?
Okay.
I'm going to start with the apices. Paraspinous. Subscapular. The lateral. Okay, go ahead and lift up your right. Okay, right medial lobe. Okay, I hear vesicular on all lung fields on the posterior chest. Next, I'm going to listen to anterior chest. Okay, I hear vesicular sounds on anterior chest as well. Okay, next I will be doing your chest. I'm gonna have you lay down on the sofa. Okay, I'll be inspecting your chest, looking for any bounding, any lifts, or thrills. Okay, and go ahead and turn to any lifts or bounding or heaves. Go ahead and turn to your right side. JVD angle is normal, 90 degree. And looking at your PMI is visible to left intercostal space, mid-clavicular line. Okay, and then next I'm going to palpate your precordium. Okay, looking for heaves or lifts or bounding. And your PMI, looking for lifts, heaves, and bounding as well. And then there's none noted. Next, I'm going to auscultate your chest. Gonna listen to. I'm going to listen to your bruit as well on your arteries. Okay, no bruit noted. Okay, and going to listen to your chest. The aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral valves. I'll be listening with my stethoscope, looking for split sounds. Okay. Okay, and next on the bell of my stethoscope, I'll be listening for any bruit. The same 5 landmarks of the chest, the aortic, and the pulmonic, and the Erb's point, tricuspid, and mitral. Okay. Next, I will be checking your peripheral vascular. I checked your arteries earlier, and now I'm going to check your brachial. and your femoral popliteal. Okay, and your posterior tibialis, and dorsalis pedis, and all pulses are present. I also need to assess your abdomen. I am looking for the contour, which is flat, and aortic pulsations is visible. And next I'm going to auscultate for your bowel sounds. Okay, all bowel sounds are present. Also, listen to your aortic. Okay, no brewing noted. Okay, next I'm going to percuss. Okay, I hear tympani on all quadrants. And next I'm going to do a light palpation, checking for any masses. Okay, and next I'm going to do the deep palpation, looking for any hepatomegaly or splenomegaly. Next I'm going to check your musculoskeletal, and I'm going to check your hip range of motion and tell me if you feel any pain, okay?
Okay.
Raise your legs, bend your knee, side to side, straight, and upward, okay? And then the other side, go up, bend your knees, side to side, straight, and upward. Any pain there?
No.
Okay, our patient's hip range of motion is full, no tenderness noted. And next, I'm going to check for your knees. Any heat or warmth there, there's none noted. I'm going to have you flex your legs, your feet there. Okay, checking for the strength. Okay, there's 5+ strength. And then I'm going to have you sit down. Go ahead and sit down for me. I'm going to check your wrist. Go ahead and sway your wrist in full motion. Make a circle. And the other side. Any tenderness there?
No.
No tenderness. All right. And then go ahead and make a muscle. Okay. Strength. Push with my hand. The other side. Okay. All right. Full strength there. Go ahead and with your knees, go ahead and lift up. Okay. The other side. Okay. And your feet, go ahead and lift up. The other side. Okay, press like a pedal. Okay. Alright. And your shoulder, go ahead and make a circle. Go up. Okay. The other side. Okay. Patient's range of motion are all intact. Let me check your joints. Checking for joints, any tenderness.
No.
Okay, and the other side. Okay, no tenderness noted on the joints. Okay, and next I'm going to have check your cerebellar. Go ahead and stand up. I'm gonna have you put your hands up And close your eyes and count from 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, this is a Romberg test. Patient passed the test. Patient's cerebellar is intact. I'm gonna have you walk back and forth, checking for the gait. Patient's gait is steady and no problem. All right, I'm gonna have you sit down again and going to check your mental status, which I did earlier, but I'm going to check your memory. Give you 3 words and tell me those words, okay? Apple, bananas, and orange, okay? And if you were driving here and then you see an ambulance, what would you do?
Pull to the right side.
Okay, and spell a world backwards for me.
DLROW.
Okay, and what are those words?
Apple, banana, orange.
Okay, patient's reasoning and thought processes and intact, and logic as well is intact. Next, I'm going to check, have you close your eyes and tell me what, on your hands, tell me this object is.
It's a pen.
Okay, I check patient's diagnosis and patient is intact. And okay, well, you can open your eyes and that concludes my assessment evaluation.